our next presentation that is focusing on the identifying unmet needs and antimicrobial resistance from both PPI and One Health perspective at a local and global level. It is a pleasure to welcome also Luis Lucena from INSERM. INSERM is the French National Institute of Health and Medical Research. INSERM, and is the public research organization dedicated to biological and medical research and to human health. INSERM is part of the RaDAR project, so they have intensively collaborated in several parts, and they are working also on a One Health policy brief. So, Luis, the floor is yours, and you can tell much more about what you are doing. Thanks.
Hello, can you hear me?
Yes.
Thank you, Maria, for the nice introduction. I'm going to share my screen. I hope you can see my slides now.
Yes, we can. Not in presentation mode yet.
Yeah, I think it's loading.
Thank you.
Yes, so as Maria said, we are working in this project with the aim to have a policy brief looking at the One Health approach to tackle AMR through innovation procurement. So this presentation is divided into different sections. One is on the One Health dimension of AMR, then about our unit and our actions at national and European level, and about the objectives of this deliverable. So thank you, Ramon, for the introduction on AMR. I think it's been very great. Now here I'm giving you a glimpse of the One Health dimension of AMR. So it is estimated that the global consumption of antimicrobials comes mainly from animals, around 70%. And many of this antimicrobial consumption goes into the environment through our excretions, and some of them are still active when it goes to the environment. Nevertheless, the current wastewater treatment methodologies are not technologically prepared to remove these AMR determinants and other chemicals of emerging concern. So this poses the risk that these determinants, these polluting molecules, go to the environment and then remain there and goes into the food chain. It is also estimated that around 56% of domestic and industrial global wastewater released into the environment with little or no treatment. That means that many countries, especially in low and middle income countries, do not have wastewater infrastructure at all or very little. And as a consequence, antimicrobial resistant bacteria and resistant genes have been found in reused water for crop irrigation and also in soil fertilization. Many manufacturing of and sites of antibiotics are located in Southeast Asia, and some studies have found high elevated antimicrobial residues in the environment, highly over therapeutic levels, so it's very concerning. And some recent studies have found that resistant genes have been found even in the clouds and also in the so-called plastisphere. So it's all the microplastic cosmos that is in the oceans, for example. If you want to know more about the One Health dimension of AMR, in the RaDAR project in 2024 for the World Antimicrobial Resistance Awareness Week, we made a series of dissemination videos on AMR and One Health. So we explained the concept of One Health, AMR, and also the need for innovation across One Health sectors. And this has been in collaboration with the JAMRAI that I will explain later. So please visit our YouTube channel and videos are there. So who are we? We are ResinFit. It's a research unit, a laboratory unit on focusing on antimicrobial and anti-infective resistance in bacteria and viruses, and we are located at the University and Hospital Center of Limoges in France. and we belong to the National Network of Institutes of Health and Medical Research, which is called INSERM. We are leaders of national and European projects on AMR. At national level and in France is Promise, which is a One Health professional community meta network to tackle AMR. And then we were responsible for the first and the ongoing second edition of the Joint Action on Antimicrobial Resistance and Healthcare-Associated Infections, EU JAMRAI. Regarding Promise, it was launched in November 2021 and is funded by the French Priority Research Program on Antibiotic Resistance. It's composed of 120 members across the human, the animal, and the environmental sectors. And the main goals are to build interactions between actors in order to break silos and improve the surveillance of AMR, improve clinical and preclinical research, and promote the sharing of data, skills, and knowledge sharing. There are many activities going on in the framework of this project, but I highlighted here some of them. So, for example, together with the University of Tours and Limoges, we have launched a university diploma called Antibiotic Resistance and the Global One Health Approach. And many students have benefited already from this degree, and we are now having another another group of students this year. We also contribute to public health policy and design and implementation of national action plans. And we have performed many webinars, and we have done a hackathon on AMR. There's been a big consolidation of research and public health groups on environments for AMR, which is called AMR-ENV. And also in the research area, there's been the anti-biodil network, where there's researchers working in France for the development of new antimicrobials. And in parallel to this, we are in charge of the EU JAMRAI as a coordination team. It's a European project financed by the Commission with 50 million euros. It's 30 countries working in this project, 27 member states plus Iceland, Norway, and Ukraine, with over 100 partners. It's a 4-year program, and it also involves the human, the animal, and environmental sector. We have 10 areas of work. Half of them are technical, working mainly on antibiotic diagnostic and stewardship, infection prevention and control, One Health surveillance, access to antibiotics and diagnostics, and communication and awareness. And this project mainly focuses on helping countries perform pilots, implementing tools, sharing best practices, building networks, and support national activities. So regarding this project in the RaDAR, in our unit, we are looking at how AMR could be tackled through innovation procurement with a One Health approach. So for this, we have decided to make a first review of the current innovation procurement regulations. The public procurement directive is being reviewed at the moment, and it's been under consultation for feedback. So we will include aspects of this, and we will list some benchmarking exercises that have been done at the innovation procurement level on all biomedical areas so far by Europe, but we will give recommendations also oriented towards AMR, and we will also add some ideas for AMR incentives that have been drafted in the EU in the first edition of the EU JAMRAI. We also have looked at the public procurement innovation practices in the field of AMR at the EU level and also at the country level for the RaDAR countries. And we want to identify barriers such as technical or governance barriers. In parallel to this, we are also mapping innovation needs for AMR in the animal and environmental fields. So for this, we have done a review of global action plans and research agendas in order to identify common and specific research needs across these sectors and identify areas for potential innovation, such as food-producing animals, food safety, plant health, and the environment. On top of this, we are also working in order to identify AMR needs for the animal health. We have launched a survey on animal health and AMR innovation with the support of Diagnostics for Animals Animal Health Europe and the Spanish Agency for Medicines and Health Products. And the intention of this survey is to have an updated inventory of potential AMR solutions that are currently available or under development in the European market, identify the technical unmet needs and demands related to AMR, and understand the enablers and barriers. This survey has been split into three parts. One on the clinical unmet needs, another on the emerging innovative solutions available, and the enablers and barriers. The survey has been postponed until the end of the project, but the sooner the better. So please, if you are involved in this sector, please have a look with our QR code. We have been doing a very big work of identifying stakeholders for dissemination of this deliverable and also for the invitation for this survey. And so we have made different categories. So procurement networks, policymakers, research and innovation networks, AMR funders, EU agencies, industries, SMEs, health practitioners, and civil society across human, animal, and the environment. The deliverable will be published around the end of this first Q1, around end of March. We will be sending to all these people the deliverable for consultation, and we will be discussing the findings in a public webinar that will be hosted in the European health policy platform, and we will invite members from One Health sectors at European level. And after that, we will publish the final policy brief with results and recommendations. And I didn't want to finish without saying a couple of things about communication. So in the first edition of the JAMRAI, they have created this symbol that you see in the center. It is the AMR symbol, which is the analogous symbol to the fight against AIDS. So we need to increase awareness about this symbol. We wanted to give it to you in the form of pins, but due to weather conditions, we are not hosting this meeting online on site. So in 2025, the communication team of the JAMRAI made a social media campaign to increase awareness about AMR through the use of famous paintings in a way that anyone could use these paintings to reflect the message on AMR in a humorous way. And it had a lot of impact in the social media. And then this year, they have selected 30 illustrators from 30 countries in order to share different stories about AMR. And this is available in our website. It's also being delivered through European countries in the form of books. And there's also an itinerant awareness raising exhibition that is currently going on in Vienna. And then we'll be moving to Warsaw in Poland, then Brussels in Belgium. And there are also dates for Madrid in Spain and Rome in Italy. And apart from that, I didn't want to finish without saying, well, thank you. Please connect with us. We in the Jamra, we have a newsletter that is sent every 3 months with our advances so far. And we have also a weekly digest on AMR news. And we also have a stakeholder forum where we discuss several things about AMR and different topics. And we have recordings on this on our YouTube channel that you can visit with the QR code if you are not part yet of the stakeholder forum. And this is everything from my side. Thank you.
Thank you, Luis, for the presentation, for the insights. It was very interesting to know what's going on in the European Union, so what other projects are there, etc. So thanks a lot for sharing. And yes, it's a pity that you could not give the AMR pins to everyone. Would have been great. I have some, so if we Luis gave them to me, so if we ever have the chance to see each other in person, I can give the pins on behalf of Luis. Thanks. It's now